Ms. Benoit. My name is Danielle Bailey. I'm a student physical therapist and I'll be working with you today.
Okay.
Today we're going to do a couple of tests that will involve your motor pathway. The first one is called the deep tendon reflex, and I will be testing your triceps tendon. So go ahead and scoot to where your feet are flat on the floor. I'm going to support underneath your arms here. Go ahead and straighten out your arm. Good. And then relax. Good. Hold it right there. Don't move. Good. I'm going to test the other side. Again, supporting underneath the arm. Relax your arm. Good. So the results for deep tendon reflex are 0. The reflex is absent. 1+ is trace. 2+ is normal. 3+ is brisk. 4+ is non-sustained clonus. And 5+ is clonus sustained. So the second test we're going to do involves spasticity of the hip flexor. So in this test, I would like for you to lay on your back, please. Just relax and then grab on the bony prominence of your foot, underneath your knee, bend it all the way up into hip flexion, and then quickly push it down. Same thing on the other side, bending it all the way up to hip flexion, pushing it down. Good. So the results for the spasticity test are 0. There's no increase in tone. 1 is a slight increase in tone, or there's a catch or minimal resistance felt. 1+ is slight increase in tone. There is a catch and minimal resistance felt, but less than 50%. 2 is increased throughout most of the range of motion. And 3 is considerable increase in tone, and passive movement is difficult. 4 is rigid. The tract that I will be describing for the motor pathway is the medial vestibulospinal tract. This tract receives information about the head and eye movement from the vestibular apparatus. The upper motor neuron for this originates in the medial and inferior vestibular nucleus and the lower pons and upper medulla. It projects bilaterally to the cervical and thoracic spinal cord. It then descends bilaterally, and it produces balance reactions and gives information about the head position. There are 2 different routes with this particular tract. The first route decussates in the medulla and then descends, and then the second one directly descends down to the lower motor neuron cell body, which is located in the medial ventral horn, and the lower motor neuron axon then travels to the upper back and neck muscles. And this is the medial vestibulospinal tract.